Welcome to the GAO Ask Dr. Kim channel. This video clip is for dentist. Let's learn dental implant treatment with GAO.
Hey, hello everybody, I'm Dr. Kim, who is one of 5 Director of Global Academy of OSA Integration. Welcome to the GAO Ask Dr. Kim channel. Today I'm going to share a clinical case of perforation repair during the sinus graft. Okay, so patient was 46 years old when first came to my office. As you see here, patient will need some extractions. Okay, so this is how it looks in the periapical radiographs. So after extraction, you can see the palatal defect on number 16 area, as well as number 26 and 27 area. So first thing what I did was I placed number 14, number 16, and the sinus graft. But I tried number 17. I couldn't get the good initial stability. I decided to place the number 17 later. Now it's time to place number 15, 16, 17. Okay. When I opened the flap, I found the perforation on number 16 area. Also, you can see the huge bony defect on number 16 area. So before you look at, you can see there was some bones on number 15 and 17. So what I did was I placed number 15 and 17 first, and then I made osteotomy on top of perforation area, and I dissected the area surrounding the perforation. When I opened, when I made a window, I used the SLA, which is my favorite, LS limers. Okay. And this technique is very well described in the textbook, says minimally invasive sinus surgery, which published 2 years ago. Now Chinese version is also available. Okay, also I'll explain about this type of technique later on in different clip. Okay, so I dissected around the perforating area. Okay, then I use a collar tape like a mop, and I put it into the osteotomy, and then I put it like a flat. So this is how I covered the perforation for this patient. After that, I grafted bone. I did the sinus graft. Okay. After that, I put the bone on the crystal area, and I cover it and sutured it. So this is panoramic radiograph right after the sinus graft and the GBR for the right side, posterior right side. Okay, so I placed number 15 and number 17, but I couldn't place number 16. I repaired the sinus perforation, and I did the sinus bone graft and GBR at the same time. But you also can see, so there is some air on the panoramic radiograph. Month later, when I took the radiograph, you cannot see the air anymore. So I waited for a while, then I placed number 16 and number 27 as well. Okay. I placed number 15 and 17 a long time ago, so I decided to go with the temporary restoration, number 15 to 17. Then I changed it into the final restoration. 3-unit fixed implant supported restoration and the SCRP type. So this is after 2015 March, and this is 2015 August. The patient came back for number 14, so I took another panoramic radiograph, and 2016 is a follow-up. While I'm doing this, I place a lot of implant here and there, and watching it until 2018 February. This is my last follow-up for this patient. So this is how I started with. This is a panoramic radiograph after extraction. So day of the sinus graft and the perforation repair. Okay, so this is the when I delivered the restoration, 2011 September, and this is the recent follow-up, 2018 February. So from the sinus graft and GBR, it's been about 7.5 years, and less from the restoration delivery, it's about 6 years, or a little more than 6 years. Okay, so that's it for today. I'm preparing a next clip is about the sinus graft, also a little complicated case. Okay, thank you very much for watching, and I'll be back.